Good afternoon. Thank you so much for staying with us and sharing, to have just preparing such a wonderful conference, which is to experience sharing among different countries as well as even beyond different continents. So first of all, I'm here by representing the Democratic Republic of Ethiopia, Minister of Health Minister, Honorable Dr. Maqdas Daba. So as just already mentioned, my name, I want to go into the just experience sharing from Ethiopia for the rest of the nation. The total population of Ethiopia, 2022, showed that 126 million of these, 33% of the population is young, that's adolescent and youth. As well, when we see the contraceptive prevalence rate, nearly 41%, 2090 Ethiopian mini demographic and health survey, now we are undergoing the DHS 2024. When we see the antenatal care for, as well as skilled birth attendant, postnatal care, and so on, is showing a good progress because of the government of Ethiopia and the global community supporting us in investing on health by developing different policies, strategies, and protocols to go forward to ensure universal health coverage, no one behind. So when we see the family planning, we have the roadmap for 2030 for family planning roadmap to secure specifically the commodity securities, already signed the compact agreement with the UN agencies, UNFPS in our country, and the government of Ethiopia is committed to support this compact agreement, yearly investing on family planning, because family planning is one of the ways to reduce maternal mortality, infant mortality, neonatal mortality, and bringing economic advancement in the nation. So the land of Ethiopia covers nearly 1,064 square kilometers. We just divided into 14 regions. Of that, 2 are urban, Addis Ababa, the capital city of Ethiopia, and as well Dredwa, one of the regional council. The rest, 12 regions we have different temperature. Some of them are very hot, that's pastoral region, and some of are agrarian, and then some of them are urban. So we are focusing on the just different contexts, developing different contexts to address those people, especially underserved populations. So saying this, the overall coverage, when we see the nutrition in 2019 mini demographic health survey showed that nearly 59% of the children under 6 months getting fully breastfed, and the other nearly 96% of the children under 5 years of age has a breastfeeding in some of the point. Immunization coverage, it shows us a great remarkable change from the year 2060, that's 39%, the fully immunized all types of antigen. Progress shown that 2019, nearly 44% of the infants of just under 1 year of coverage. When we see the maternal mortality, Ethiopia shows one of the exemplar country which is conducted on 2023 in the Cape Town meeting, that's IMNH 2023, the country which shows a remarkable change in reduction of maternal mortality from the year 2000, 953 per 100,000 life to 267 per 100,000 of live births on 2023 by the UN Interagency Group estimation. Somewhat we are challenging with the new neonatal mortality. Still we have changes from the 2000, that's nearly 49%. By now it reduced to 26 per 1,000 live births. That shows that the report is taken from the UN estimate. So when we see the overall condition of the Health of Ethiopia, Ministry of Health is designing different strategies, policies, and recently, maybe you informed that the National Health Policy is endorsed for the second time, and mainly focusing on the reproductive, maternal, newborn, child, and adolescent youth health. So it's giving a due attention for the reproductive, maternal, newborn, and child, adolescent as well. So overall, just we have experience related with self-care intervention as a nation. Self-care is one of the service modality which is approaching the community which is underserved, just because we are challenging with the three C's, the conflict, COVID, and as well with the climatic change. So for such a population, one of the issue to addressing their health gap is just empowering individuals, empowering families, empowering communities, empowering the nation. It's the way of modality addressing the health service. The other, just having self-care intervention as Ethiopia is just developed and endorsed launching and implementing in 4 regions self-care intervention to see how it is impactful and how to its progress, and to see even the barriers for the implementation of self-care intervention. So the result showed that there's a promising at different levels. There is a barriers from the programmers, from the region, health facilities, communities, and at different level of the populations. So self-care intervention has its own national self-care network, which is just established by Ministry of Health and its partner to ensure the implementation of the program. The other self-care intervention may have some challenge we observed during the implementation. One is the challenge from the healthcare provider. They asked that, what's the difference from the routine service we providing so far? They try to just to bridge this or to solve this problem. We try to capacitate healthcare worker to support that individual families and communities. So as we all know, Ethiopia has a different health tiering system that is from the referral hospital until the household. We have a structure. So at community level, we have a volunteers, women development armies, health extension, salaried health extension programs. That's nearly 14,000 health extension programs we have at the community level. They provide basic essential service for women, children, and all part of the communities living around that health posts. We have around 18,000 health posts as a country. We have just primary hospital, all over hospital. We have 420 hospital. Of these, 60% of the hospital is a private owner. The rest, 86% is from the government. The other is we have nearly 3,776 health centers, which is most of them resigned just under the leadership of government. We have a positive interaction with NGOs, partners, and different UN agency to realize the quality care for our citizens. So self-care is one of the outlets or the modality which is providing to ensuring universal health coverage by reducing a cost. Because when a woman comes to health center or hospital, she took money to just get that service because it's minimum, she should have money for transportation. She consumes her time for maybe, she may be a farmer or she may be a merchant, just that save that time. And also, it's a tailored intervention for the marginalized population because of COVID, that previously may affect still now, and the climatic change, and there is a conflict and even a war in some part of our country. So to addressing all this community, self-care intervention is a key. The other very important intervention area is catchment-based clinical mentorship. Catchment-based clinical mentorship has its own strategic document, guideline, which is previously implementing under the leadership of only maternal health, but nowadays, by doing assessment by different external organizations, the input we provide to implement that program and the output we gain is so very remarkable, so that we try to integrate along the continuum of care. That means just providing service for pregnant women and pre-pregnancy, because we developed already pre-conception care guideline. Because Ethiopia is investing a lot on reproductive health, still needs to just harnessing or fastening everything to just reducing maternal mortality, ensuring family planning prevalence rate to increase that, and reducing perinatal under 5 and infant mortality, and ensuring the need to ensure the demand of the adolescent and youth health service. So catchment-based clinical mentorship, making integration is just keeping the continuum of care. Even we are doing a research, what is the gap of the continuum of care from preconception into postnatal care? There is a fragmentation and there is a dropout rate from the preconception till postnatal care. So this evidence shows that it should create some policy or some intervention to strengthen that tie, fragmented tie. So just investing around 250 hospitals to mentor the catchment health center under that hospital. Just a senior expertise is moving from the hospital to the health center, providing technical support as well as in terms of knowledge, attitude, and skill, as well as they exchange legally the resource. If there is ample resource at the hospital level and there is a shortage at the health center, they exchange. Just by doing this whole thing, the result we found that there is a reduction or decreasing the referral, unnecessary referral among health facilities. And the other, there is smoothing the communication between healthcare workers among those in hospital as well as in health center. Making this smooth communication, it make widening or open up for positive communication and support technical in every part, just in all-rounded base. So we just have taken a leadership. The challenge we have related with integrated catchment-based clinical mentorship is resource-related. Because at a time, one hospital gets a seed money from the government for, as based on the WHO recommendation, for 6 months to mentor 2 health centers. But minimum one referral hospital or general or primary has minimum 7 health center, maximum 34 health center. So it's difficult to address this Menti facility. This is a challenge. So we try to design how to solve this issue. They're working with partners when the new project is
rounding up now.
Coming, okay. This I'm jumping to the SRH in humanitarian. We have a policy document for SRH in humanitarian and start to implement specifically those areas with conflict, COVID as affected, and as well as the area with climatically affected areas. So it shows that that policy document is well comprehensive and supporting all to ensure everyone getting the quality RMNSH services in our country. So finally, I would like to thank you, Minister of Health Ethiopia, giving such an opportunity to stand in front of you, talking about my country, and just appreciating the government of Bangladesh just preparing such a wonderful experience, sharing international conference, UNFPA supporting financing, not here in many parts of the country. Overall, just I would like to thank you. Thank you so much.